writing historiographical review and perspective in psychedelic science. So we'll begin by talking about older adulthood kind of broadly. It can be characterized by a variety of cognitive and affective changes. Older adults are generally less creative, they score lower in executive functioning measures. There's a variety of emotional changes that have been documented in older adults as well. They're generally less open, they have declines in empathy, they're generally more pessimistic, which can lead to depression. There's actually spiked rates of suicide in the late age. And they also suffer from a paucity of meaningful experiences. One study, they had participants, elderly participants, create lists of the most meaningful events in their lives. And out of the 50 participants in this study, not a single person listed an event after the age of 40, which is a little depressing. But it's not to say that aging is inherently negative or always bad. A lot of older adults still experience high quality of life and emotional stability into late life. But risk factors for cognitive and affective decline can have a cumulative risk across one's lifespan, ultimately leading to impairment. So while older adults show these changes at the group level, different variables can exert compensatory effects on individual trajectories. And what's interesting about these changes that have been documented in older adulthood is they map pretty well onto a lot of the findings from recent psychedelic studies. So I'll get into more details about these studies later, but as a quick overview, some studies have shown increased creativity after psychedelic use. It's associated with heightened executive functioning in some studies. Pretty reliable finding is that it can increase openness. There's also evidence that it can increase empathy. And declines in pessimism after psychedelic therapy can mediate antidepressive effects of the therapy. And they can also induce meaningful experiences. And finally, it's associated with reduced opiate abuse, which can be heightened in some older populations, at least in the US. And while some believe that declines in neurogenesis and neuroplasticity contribute to age-related changes in cognition and affect, there's evidence in animal models, at least right now, that psychedelics can stimulate neurogenesis and plasticity. So what we're going to do is delineate these connections between older adulthood and psychedelics and to assess whether they can be incorporated into research with older adults. Then we'll also tackle the intuitive follow-up questions of mechanisms of action and safety concerns. So we'll begin with creativity and cognitive parallels. So as I mentioned, there's a variety of cognitive changes in older adulthood, including declines in creativity and executive functioning, and these can impair one's quality of life. And anecdotal reports about using psychedelics to increase creativity date back to the first era of research, and they were espoused by pretty diverse figures, everyone from Aldous Huxley to Francis Crick to the Beatles. And researchers soon picked up on this connection, as demonstrated by a variety of articles published during this time. And Dr. Sessa has a good review paper on that period of research on creativity for those wanting to learn more about it. And today, researchers are revisiting the link between psychedelics and creativity. So Kuipers found increased divergent but impaired convergent creativity while on ayahuasca. Another study found increased convergent creativity that was sustained for 4 weeks. And finally, another study found improved divergent and convergent creativity on microdoses of psychedelics. Though it's important to keep in mind, especially with that last study, participants were self-selected and not blind to conditions, which can be a pretty big problem in psychedelic research. It's hard to blind people between a consciousness-altering drug and placebo. But the discrepant findings in the literature so far can probably be attributed to difference in timing, so acute versus non-acute effects, as well as dosage. But the wealth of anecdotal reports and the findings from preliminary empirical research suggest the link between psychedelics and creativity. So they may be able to stimulate new ideas or styles of thinking in the elderly. As I mentioned, executive functioning is also generally decreased in older adults. This includes things like working memory, shifting of attention, planning. And there's some evidence suggesting that psychedelics is associated with improved executive functioning. So one study found that compared to non-users who were matched for sex, age, income, and education, psychedelic users performed better on the Stroop test, the Wisconsin card sorting test, letter number sequencing test, and the frontal systems behavior scale, which indicates increased working memory and set shifting, two key components of executive functioning. And these findings were replicated in another study from the same group. However, it's important to keep in mind that they are correlational. We do need experimental research to delineate causation. But given that psychedelics have been shown to stimulate plasticity in animals, and hence plasticity has been shown to increase executive functioning, there is some reason to expect a causal link there. So these findings, in tandem with the findings on changes in creativity, suggest that psychedelics may be able to attenuate some of the cognitive changes documented in older adulthood. The most striking parallel between psychedelic drugs in older adulthood regards their connections with affective processing. So as I mentioned, older adulthood is associated with a variety of affective changes like decreased openness, empathy, changes in pessimism, depression. And these changes in affect can have important implications for older adults. So treating depression can stave off cognitive decline related to Alzheimer's, and increased openness has been related to positive aging outcomes across a variety of measures. And psychedelics have been shown to increase openness across a variety of studies. Griffiths et al. Found that a psilocybin session increased openness more than a control session using methylphenidate. However, it's important to keep in mind self-selection and experimenter biases, given that the recruitment materials for these studies often indicate that people will be taking psilocybin. And self-selection biases can be a particular problem, especially when you're using participants who are not hallucinogen naive, so people who have tried them before. That's a problem because ostensibly only people who have had positive experiences with the drugs are going to want to participate in a study that uses them, and people who have had negative experiences with them are not going to want to take them again. So it's important to keep that in mind, as well as experimenter biases, since a lot of these studies are unblinded. But that being said, increased openness has been pretty reliably shown in the literature across a variety of studies. And this can have downstream effects on other cognitive and affective outcomes like creativity and empathy, which has also been shown to be increased by psychedelics. So perhaps the most rapidly growing area of research is in their use for treating affective disorders like depression and anxiety. Older adults experience more impairment related to depression, and there are spiked suicide rates, as I mentioned. And there's evidence mounting that these drugs can help attenuate some of these symptoms. So for example, up to 80% of depressed patients had a reduction in symptoms that were maintained for at least 6 months. And this was documented in 2 studies that were run and published concurrently. They were double-blind, placebo-controlled, and crossover trials, so pretty methodologically rigorous. And other studies have shown that decreases in pessimism can mediate antidepressive effects of psychedelics, suggesting that they could be particularly useful for older adults with heightened pessimism. And correlational studies show a negative relationship between psychedelic use and psychological distress and suicidality. So altogether, there's mounting evidence that these drugs can induce changes in emotional processing that run counter to the changes seen in older adulthood. As I mentioned, the elderly also report a lack of meaningful experiences. And this can also have important implications, as low meaning in life has been linked to increased suicide, and treatments that specifically try to increase meaning in individuals' lives can improve well-being. And Griffiths and colleagues found that 2/3 of their participants rated that their psilocybin session was among the top 5 most meaningful experiences of their lives, among events like the birth of a child or death of a parent. That 2/3 number has been replicated in a few other studies since then. And further, 38% said in this study that it was one of their top 5 most spiritually significant experiences, and 79% rated that the experience improved their sense of well-being and life satisfaction moderately or very much. So these results indicate that psychedelics can induce experiences that are incredibly meaningful and even spiritual for some individuals, which could have important implications for older adults experiencing a lack of meaningful experiences. And relatedly, their use in palliative care is a rapidly growing area of study. This line of research was also predated by studies in the first era of psychedelic research, but improved experimental methodologies definitely enhanced our understanding of the role these drugs can play at the end of life. So the first modern study conducted in this era was in 2011, and they found modest improvements in end-of-life measures, but they were limited by a relatively low dosage of psilocybin in a small sample. More rigorous studies followed in 2016, as both the Griffiths and Ross labs both found robust decreases in end-of-life distress. And notably, the average age in each of those studies was 56, so it does seem that they can be implemented into populations approaching older adulthood. And finally, psilocybin treatment has been shown to lead to increases in life satisfaction, positive attitudes about life, and spirituality in a dose-dependent manner. And these can be critical factors in healthy aging and buffer against emotional distress. So natural question when discussing this wide variety of changes is how does it work? So next we're going to tackle some of the proposed mechanisms underlying their effects. So they exert their acute effects at serotonin 5-HT2A receptors, which are widely distributed in the brain, explaining the diverse effects of the drugs. And they're involved in cognition and memory. In animal studies, 5-HT2A activation has been associated with increased cognitive flexibility, which could explain the drug's effects on depression, executive functioning, creativity, all these things that require some degree of cognitive flexibility. And another more speculative explanation for the drug's long-term effects is increased neurogenesis and neuroplasticity. So decreased neurogenesis is thought to play a pretty key role in age-related cognitive and affective decline, as neurons that die off aren't replaced as efficiently. And some argue that interventions which target neurogenesis can be used to attenuate these changes, as well as changes in depression in other studies. But again, since this hasn't been documented in human samples yet, it's very speculative, and I'm not going to discuss it too much right now. Others argue that the profound sense of connectedness and unity while on the drugs explains their therapeutic potential. Individuals often report a sense of oneness, ego dissolution, loss of a sense of self while on the drugs, and validating these anecdotal accounts, the default mode network, which is fundamental in maintaining our sense of self, is deactivated while on the drugs. And Mueller and colleagues argue that the functional disintegration of the default mode network during psychedelic states can drastically alter aspects of consciousness through transient decreases in self-referential thought and access to autobiographical information. And this shift in perspective could explain changes in openness and empathy. And indeed, also, studies have shown that the extent to which the default mode network shuts off has been shown to predict changes in openness as well as therapeutic effects. And finally, given that depressed individuals are characterized by more self-referential cognitions, they're often very innerly focused, and increased default mode network activity, it seems that these changes in one's sense of self can be an important mechanism underlying the effects of the drugs. As you heard about in the last talk, the most common explanation underlying their effects regards meaning or mystical experiences, which are marked by a profound sense of meaning and sacredness, interconnectedness with others in the world, transcendence of time and space, ineffability, and a deep positive mood. And Grob argues that the mystical experience is critical in mediating psychedelic benefits, particularly in palliative care. They argue that the patient's existential self-image can be recalibrated during this time of transcendence, such that they adopt a broader existential perspective, and the concept of death is less anxiety-provoking. And psilocybin's tendency to increase a sense of continuity after death may also be important for palliative care. And speculatively, the changes that have been documented in animal models and plasticity may, one thing allowing these epiphanies that people have on the drugs to stick long after the effects have worn off. And just to demonstrate the importance of the mystical experience, it's been shown to predict a wide variety of outcome measures. So those who have more mystical experience also are more likely to have changes in substance abuse, changes in affective disorders. The more mystical the experience was, the more it's been shown to be meaningful and spiritually significant. And finally, the degree to which the experience is mystical has also been shown to predict changes in openness. So it does seem like it's, rather than it being a direct pharmacological effect, the drug's potential for facilitating a certain type of experience seems to be one thing accounting for a lot of the variance and long-term changes. So natural concern when considering administering illicit drugs is safety. We're not recommending that elderly individuals just go out and take these drugs unsupervised or without any preparation or integration. Researchers put a strong emphasis on preparing individuals for the experience and emphasize that not all the effects may generalize to recreational use. Consulting physicians should consider acute increases in heart rate, blood pressure, and body temperature. And there's also some concerns about acute anxiety, particularly at the onset of the drug, but that's generally transient, and researchers have been able to manage those situations pretty well, it sounds like. So that being said, correlational studies have shown that psychedelics are not linked to mental illness, and rather they're linked to reduced psychological distress and suicidality. Another study found that ayahuasca users scored lower on every psychopathology measure they administered compared to non-users who were matched on demographic information. When evaluating the abuse potential of psilocybin against the 8 factors of the U.S. Controlled Substances Act, Johnson and colleagues concluded that there's limited harm associated with the drugs. But this isn't to say that they are risk-free. They can induce experiences that are incredibly psychologically challenging, particularly in the absence of proper set and setting. But limited harm has been reported in the new era of research, which utilizes pretty rigorous preparation, supervision, and integration procedures. And indeed, Ross noted that over 2,000 participants have been run through carefully monitored sessions so far, and this was a few years ago, with 0 long-term effects reported. And the Johns Hopkins lab has a good paper on safety guidelines for those interested in more on that. And finally, rather than being a gateway drug, psychedelics use has been associated with a 40% reduced risk of opiate abuse, which could be another potential benefit for the elderly given the rapidly rising rates of abuse in that population, especially in the United States. So there's a couple of logistical and practical concerns that need to be addressed to begin using these drugs to attenuate age-related changes in cognition and affect. So the first regards when should they be taken. Perhaps taking them in early adulthood can help buffer against downstream effects from chronic traits that psychedelics have been shown to change, things like depression and pessimism and openness. But it's still not clear how long these changes are always maintained. A variety of studies have shown some changes maintained for at least a year, while others suggest booster sessions could be valuable. So that's another question that needs to be addressed. But given the growing number of studies, it seems we're probably going to get more robust longitudinal studies soon, which can inform us about proper dosage and how often they should be taken. And finally, the degree to which all these effects generalize to older adults is still unclear, given that older adults have only been incorporated into some of these studies. Since other treatments like cognitive behavioral therapy have been shown to need to be tailored to older adults by incorporating things like mobility and bereavement and loneliness. In the same way, psychedelic treatment might need to consider what individual differences there might be in older adults to help some of these effects generalize more. So to conclude, the literature demonstrates a variety of connections between age-related changes in cognition and affect and the effects of psychedelic drugs. The two have been shown to have opposing effects on creativity, executive functioning, openness, empathy, pessimism, depression, meaningful experiences, opiate abuse, as well as neural changes. So the background literature does suggest that incorporating these drugs into older adult research can be a viable and likely impactful area of future study. But our critical analysis of the background literature suggests that future researchers should consider self-selection biases, experimenter biases, standardized dosages, better control groups, and generalized ability to improve future methodology in psychedelic science. So any questions?